There are only a few causes of recurrent miscarriage. You can have a chromosomal abnormality. For that, for sure, we do a karyotype. That is, it's a simple test. It's either through your blood or your saliva, and we do a chromosome count, basically. And that karyotype will tell us if you have a translocation. What a translocation means is that a part of one chromosome uh, is not existing in your cells, but except in a different chromosome where it normally wouldn't be. So you have all your genes, and the genes do not have to be in any specific order in order for you to be completely normal. It's really funny how that works. The genes, it's amazing, really. They can be anywhere. You can put your chromosomes into a Cuisinart and chop them all up and let them fall back down again into the nucleus. And as long as you have all those genes, you're going to be okay. So translocations that have all your genes we call balanced, and that means you're normal. But then when the chromosomes divide in making an egg or making a sperm, then they may divide in such a way that you are missing genes on some of the chromosomes in that embryo. And if you're missing those genes, the embryo's not going to make it. It'll implant, but you're going to miscarry sometime. And those are usually miscarriages in the first 10 weeks, not usually later miscarriages. But it could be later, but it's usually an early miscarriage. And so that we test for translocation to see whether you have that. Also, we have to do a 3D ultrasound so we can see whether you have a normal uterine cavity or a septum, where a little bit of uterine muscle is dividing your cavity into two parts. And that can be a cause of miscarriage that has to be ruled out. Sometimes you had a baby and they're retained placental fragments. And after that, you just have nothing but miscarriages because those placental fragments also do the same thing a septum would do and make it impossible for the embryo to develop properly. So those are really the major causes of recurrent miscarriage, and especially 5 miscarriages. So if you have a septum, we just fix that surgically. And it's not that hard to do. And if you have a translocation, either you or your husband on the karyotype, then we'll biopsy your embryos and we'll look for the embryo that doesn't have an unbalanced translocation. You obviously have a balanced translocation with all your genes, or you wouldn't exist, you wouldn't be alive. But we would only transfer to you the embryos that have either a balanced translocation like you have or no translocation. But we wouldn't transfer an embryo back to you that's destined to just miscarry because of an unbalanced translocation. We can also do aneuploidy screening with that biopsy. But as I've said many times, it's extremely inaccurate because there are many embryos, many cells in an early embryo that are abnormal. Now, translocation screening is very accurate, but screening for aneuploidy is very inaccurate. But anyway, those are the approaches, and there's no reason why we can't manage recurrent miscarriage successfully.